started as a headache, and then it moved into my ear. It really hurts.
Well, the doctor will be in just a little bit. Hang in there, Heather. We're going to get you taken care of.
Pediatrics is one branch of medicine that demands a focus beyond the individual patient and immediate health problems. Pediatrics must focus on the developmental stages of the child over time, on the child's position within a family, on the unique cultural characteristics of the family, and on techniques of assessing and providing care in ways that minimize the trauma and upset to children who often do not fully understand what is happening.
Hi, guys.
This program on pediatrics will discuss the characteristics of the developmental stage of adolescence, as defined by the American Academy of Pediatrics, including some of their physiological characteristics and some appropriate forms of care. We will discuss ways of working with the entire family, since at least with younger adolescents, the family are still the experts and often the primary caregivers. We will discuss dealing with psychosocial and cultural differences and how the pediatric nurse must be aware of these and incorporate them without bias into an objective assessment. And we will discuss some methods of non-traumatic physical assessment and care techniques for use with adolescents, particularly as they relate to issues of weight and sexuality.
So, Sarah, how are things going?
Good.
By age 12, most children begin entering puberty and are considered adolescents until about age 18.
She started her period while we were on vacation, and I didn't start until I was 3 years older than her, and I'm just kind of worried about it. That seems kind of young. It's very normal. There's nothing to worry about at all. Many girls begin menarche earlier these days. Anywhere from 10 years old to 15 years old is considered very normal.
This is a period where growth spurts upward and the body transforms into an adult, sexually mature body, and physical appearance becomes increasingly important. At this age, adolescents are moving toward adulthood, and they are able to entertain complex moral thinking, and they begin to make up their own minds and choose their own values. Peer groups remain a strong influence and can come into conflict with family demands.
So, Heather, have you been sexually active?
No.
Both male and female adolescents must learn about sexual responsibility and ways to resist vastly increased temptations to substance abuse.
What about driving? Will you be driving soon?
Risk-taking, particularly in driving and risky sports, also need to be addressed.
Okay, Heather, you want to step on this scale? How are things going for you this year at school?
At adolescence, you should begin looking for signs of common adolescent health problems such as obesity or eating disorders, acne problems, STDs, substance abuse, depression, and any stress-related problems. When working with adolescents, remember their self-consciousness about their bodies and provide for privacy.
Okay, Heather, I'm going to give you this gown so you can get dressed, and I'm going to step out and give you some privacy. Okay?
Talk directly to the adolescent, not through the parents. Always explain why something is being done. Be considerate of how any treatment may affect the adolescent's appearance and relationships, because these are very sensitive issues at this stage. Encourage questions about their fears, and respect any expressed or implied religious or cultural beliefs. Check for family histories of genetic-related diseases, such as cardiovascular disease, diabetes, or sickle cell trait. All of these diseases should be screened as appropriate. Adolescent girls should be taught breast self-examination, and boys should be taught testicular self-examination. Encourage the teen and parents and peers to have open communication on any issues of concern.
Well, that sounds like something we should talk to your parents about. I'm going to go ahead and get them and bring them in. Is that okay with you?
As an outside authority, you can often play a powerful role in opening up channels of communication. Adolescents are approaching adulthood and often need to be interviewed without their parents. Still, you should try to include the family as much as possible in healthcare discussions and decisions. And you must remain sensitive to cultural differences on many issues.
She's only 16 and she wants to go alone on dates with boys. I know some children do that here, but it's not part of our culture.
Many people in America tend to feel that the way our culture behaves is the way all cultures should behave. But every society is unique, and every immigrant group has to make its own accommodations at its own pace with the general American culture. As cultural groups adapt to living in a different society, the changes can involve both losses and gains. For example, in most cultures, adolescents are more respectful, less rebellious, and less violent than many American youth. Listening intelligently and sensitively is your best asset as a nurse. You need to become aware of many cultural differences to do this.
She felt and hurt her wrist and get those scrapes on her elbow.
In many Asian and Native American cultures, for example, eye contact is considered rude. It does not mean the person is ashamed of something or is not listening to you.